Good morning, good afternoon, depending on where you are in the world. My name is Lydia O'Neill, and thank you so much for having me at the NRI Gender Research Day. So I am currently a postdoctoral fellow at the Cornell Atkinson Center for Sustainability, but the work I'm presenting today, I actually undertook as part of my PhD with NRI. So I would first like to express my thanks to my PhD supervisors, Dr. Kate Wellard, Dr. Paula Dominguez-Salas, both from NRI, and Elaine Ferguson from the London School of Hygiene and Tropical Medicine. So today I will be presenting two parts of my PhD work. One is a new conceptual framework for women's food environments, which is drawing on a scoping review that has recently been published in the Lancet Planetary Health. And alongside this, I will be presenting preliminary results based on my work on women's food environments and nutritional adequacy in northern Uganda. By way of background, and as you're probably already very aware, there is a really high prevalence of malnutrition in women worldwide, and in particular in low and middle income countries and in the most resource scarce areas. Now, it has been estimated that at least 70% of women worldwide have at least one or more micronutrient deficiencies. Now, we know that there are multiple micronutrients that are critical for public health. Some of the core ones are at least 11, but when this study was estimated, they could only look at 3. So we know this is probably an underestimation. Also, the most popular state of food insecurity and nutrition in the world has been tracking women's food insecurity over the last couple of decades. And unfortunately, women's risk of food insecurity is consistently at least 10% higher in relation to men. And this is regardless of income level, geographical location, just indicating that there is a higher risk there. Also, something else that has been concerning is despite decades of intervention, anemia rates in women, especially since the COVID-19 pandemic, have been increasing, which is not the way we would like things to go. We would definitely like to see these malnutrition rates declining, but unfortunately, they're going in the opposite direction. Now, over the last decade, a lot of work has been done in refining food systems frameworks and food environment frameworks to really help stimulate that focus on multi-sectoral solutions for addressing malnutrition in low resource contexts. However, despite this increased focus and the progress to date, there is actually little that has been known about the characteristics of food environments that might be unique to women in low and middle income countries, which is why the first paper I'll present here is the project that I worked on, which was really to identify and map what are the characteristics of food environments that influence the food acquisition practices and the dietary intake of women of reproductive age in low and middle income countries. And the whole goal of this was to refine food environment frameworks to make these, to identify intervention areas that really could make these programs and policies more effective. Now, to do this, I conducted a systematic scoping review, which involved searching Web of Science, EBSCO-host, and PubMed for all of the peer-reviewed studies that really did cover key areas of women's food environments. This was conducted in English, Spanish, Portuguese, and French. We screened over 3,700 records and we ended up with 518 studies for synthesis. As you can see, most of the studies that were included were in English, but there was still a very good handful in Spanish, Portuguese, and one in French. Now, just before we go to the next screen and the results, I would just like to highlight that one of the most common reasons that we had to exclude papers was because the data was not disaggregated by gender, which in and of itself is quite telling about the state of the field, because even though we know that women are at higher risk of food insecurity and malnutrition, unfortunately, sometimes the data is just not at that disaggregated state for us to be able to really identify what are some of the key leverage points that we could be addressing to make these policies and programs more effective. And here is a map really demonstrating that geographical spread of the 518 studies that we included, which covered 125 low and middle income countries. So on one hand, this is really nice to be able to demonstrate that the themes that I'm going to present next are quite consistent across sub-Saharan Africa, South Asia, Southeast Asia and the Pacific Islands, and also Latin America. But also it does also demonstrate where there is clusters of extra, like some countries are very well represented in comparison to other countries that have a real lack of studies and data. So you can see here quite quickly that we have a lot of studies represented for Ethiopia, Brazil, and India, and a lot less, say, in West African Sahel, even though there's very high malnutrition rates there, and also, say, for instance, the Pacific Islands. And this is the final conceptual framework, which was published in the final paper in the Lancet Planetary Health. Now, I apologize, there is a lot of information on this slide, so I'm going to step you through some of the key elements. So this framework really does build on that socio-ecological model of all of these different layers of the food environment that ultimately influence what food a woman eats, procures, and then she finally eats. So what contributes to her dietary quality and her dietary intake. So on the outside here, we've got the foundational elements of stability and sustainability. We have the external food environment. So that's really looking at that structural food environment. So what foods are available at different food sources, at what price, what are the vendor properties like, their surrounding marketing and policies. And we've also broken it down here. You'll notice that these are all the different food sources where women were getting their food. So they were procuring food from a variety of different sources. So from the wild, from cultivated home production, from informal markets. So those weekly markets that might come up on the weekend, more formal markets or kiosks that are more there on a permanent daily basis, food aid or feeding programs, and also social exchange. The food that is shared between family, friends, and neighbors. Then we get into that personal food environment. So this is really more at that household community level. So this household level really accounts for affordability. So you might have food prices externally, but internally, what is the income of that household? What can they actually afford with the money that they have? And also, what about accessibility? So physical proximity to different food sources, food literacy preferences, social norms actually came up quite a lot. What are the social cultural norms in that household or that community that shape those kind of behaviors? And also things like intra-household allocation of food. And then ultimately, we found that one of the biggest mediators for what food a woman procured and ate was actually women's individual agency. And this I will talk about a little bit more in the next slide, but we really found that this was the linchpin. This was the key mediator and also the key novel aspect of this new conceptual framework was just really highlighting you could have a beautiful external food environment. You could have a strong personal food environment, but ultimately that woman had to have her own agency for that to then translate through to her optimal dietary quality. So really to tease this out, we found that at least 30% of studies across geographical locations, so whether it's Latin America, Sub-Saharan Africa, Asia Pacific, whether it's rural, whether it's urban or peri-urban, we found that these were consistent mediators of women's agency that were important for her dietary quality. First was decision-making power, or really the individual's ability to exert control over her own resources. So control over household food choices, what to buy, cook, and eat. Second was financial autonomy. So that was her access to and control over income and financial resources, and also control over her own ability to actually go out and generate income. Third was bargaining power. So her capacity to negotiate within her household environment and other household members over the existing resources that were there. Fourth was control over time. So managing a lot of those unpaid demands about care, domestic caregiving labor, and other cultural demands on her time. And lastly was freedom of movement. So the ability of a woman to leave the house. So is it socially, culturally appropriate? When is it appropriate or considered appropriate for her to be able to leave the house? Does she have that social norm allowance to travel to markets? And if so, how close to the household and at what times of the day? And also her ability to access health services and extended networks. So we found that all of these were very consistent and very important, and that at least 30% of studies highlighted this area, but unfortunately it was something that was missing from the previous or the existing frameworks that we've been working with. So hence it was really a key thing here that we highlighted. Now, this one is also a lot of detail, which I apologize for, but I really wanted to show you this slide because ultimately we found 153 food environment drivers of women's food acquisition and dietary quality, just to really demonstrate that women's food environments can be complex and at multiple layers. We ultimately distilled this down into these 15 overarching themes here, which I've broken down by their geographical evidence distribution. So you can see straight off the bat, we actually have quite a lot of evidence from Sub-Saharan Africa, which is extremely helpful, especially for certain areas. But you can also see that we have some themes that are well represented versus others that are less represented. So this really highlights some opportunities for exploring some areas further. So we have women's agency covered across all of the areas, but some of the areas like Southeast Asia, the Middle East, North Africa have not been covered as well as some of the other areas. So this is a real opportunity to really explore that and tease out those leverage points better. Also, we know that some of the elements like social capital are incredibly important for resilience moving forward. We can see this emerging evidence that this is a key point, but it's also underrepresented relative to some of the others which are overrepresented, like food literacy, availability, or affordability. So it really just highlights, okay, where are some of these concentrated evidence? Where are some of the gaps? Where are some opportunities that we could explore further? So really to now put this in context, I will move on to my primary data collection and evidence, which was generated in Northern Uganda in 2022. So this involved mother-child pairs from the Quania area, which is highlighted here by the red circle. So these were villages where women were in between the River Nile here and Lake Quania here. And so half of the women were close to fisheries and half of the women were far from fisheries. So ultimately, this evidence here that I'm presenting is of 124 lactating women from this area. So this is a rural area, extremely low resourced, post-conflict. Most of the households were severely food insecure, and a third were living below the poverty line, which was defined as $1.95 US per day. So it's really worth keeping this in mind. We collected 24-hour observed weighed food records. So in other words, the enumerators followed the women around, so shadowed the women all day, weighing everything that they and their child ate. And we also conducted market price surveys as well, so that we could determine what was the cost of the edible portion. Now, we found that the scale of hidden hunger, or that is the percentage of lactating women at risk of inadequate micronutrient intakes, was strikingly high. So over 50% of the women were at risk of inadequate intakes for 10 out of the key 11 micronutrients. Now, this was 100% for vitamin A, 99% for calcium, 90% for B12. So in other words, only 9% of these women achieved the minimum dietary diversity, which is one of the key Sustainable Development Goal indicators. The B vitamins, at least 50% of them were also at risk of inadequacy for the B vitamins. Zinc, less so, but still there. So you can see here visually, there is huge hidden hunger concerns. And another key point to highlight was that at least a quarter of them were underweight, so they were easily malnourished, and the median diet cost was $1.10 per day. So just remember, if they are one of those households that is under the poverty line, where the household is earning less than $1.95 per day, you can see just the women's diet could be costing most of the household income if she had to buy all of it. So I then did diet modeling to assess, could we close some of these nutrient gaps if we could increase the consumption of some of the locally available nutrient-dense foods that are in their food environment, while also constraining, so not blowing out their diet costs, because we know they just don't have that extra money available. And I did find that with the dietary modeling that dark green leafy vegetables really do punch above their weight. So they were able to contribute to all of those key nutrients that we know that are of concern. And also a lot of these dark green leafy vegetables, they were procuring from the wild or home cultivation. So it's also extremely low monetary cost. The other one is sweet potatoes, which are commonly also cultivated at home. Most of the ones cultivated in this area were white sweet potatoes. To really address that vitamin A, orange sweet potatoes might be a key area to introduce here. From the animal source food perspective, local fish was incredibly important, especially for things like B12 and highly bioavailable iron and zinc. Then whole grains came next, like millet or unrefined maize. The other animal source food that could be leveraged is cow's milk. So this was in the wet season. So cow's milk was available. So in other words, there is a lot more greens happening, or pasture for the cattle to access. So milk production is there. And we did find that there is cow's milk in their local food environment at quite an affordable price during the wet season. So this might be something that could also be leveraged. And then lastly, beans. So beans are culturally incredibly important, highly affordable and accessible, and also incredibly strong sources of iron and folate in particular. However, no matter how much we are able to increase potentially some of the most nutrient-rich foods that are available in their local food environment and also culturally familiar and appropriate, I did find that there's a couple of serious problem nutrients that would be very difficult to close those nutrient gaps, especially when controlling for diet costs. So vitamin A and iron. And considering their current median diet costs and the costs of animal source foods, if it has to be purchased from the market, it would be very difficult to meaningfully close these gaps. So here, this is maximizing the diets, but even with maximizing the diets all the way up to $1.60 per day, we would not be able to close the vitamin A and iron gaps. So this really does highlight the importance of complementary interventions to really increase production alongside other things like reducing the cost of animal source foods. So to really drive this home when identifying key areas for intervention, it can be helpful to really look at where these women are sourcing all of these key ingredients from. So we found that just over 40% of all of their ingredients, they were sourcing from the home or from the wild, which is really no surprise. They've got quite low incomes, so subsistence is one of their key areas for their local food procurement. And this was really important for those dark green leafy vegetables, the legumes, sweet potato, the groundnuts, and the whole grains. The other one that also came up was the temporal market or the weekly market, which was one of the main sources for animal source foods. So catching fish from the wild was important for these women because it was easily accessible from the lake or the River Nile. But if they couldn't access it directly from their natural food system, so in other words, if those women were further away from those systems, then they were purchasing it from the market. And it was most likely coming from that weekly market on the weekends where the prices tended to be cheaper. There was also the cow's milk that was coming from the informal vendors. So this was commonly transported to the villages on the back of motorbikes. And this would come in as it was available from the farmers. And the women would purchase this usually in 250 mils at a time. They also sometimes ate eggs and beef meat, but the beef meat in particular was very much limited to special cultural events like weddings or funerals. So really we were able to identify that it was those smaller price units like fish and milk that would be more easily able to be leveraged. Also, unfortunately, we also identified processed foods or nutrient-poor foods that were highly prevalent and highly accessible in permanent kiosks or permanent shops within villages and very close to villages. And as the nutrition transition really does start to gain momentum, and as food environments transition and transform, it will be really important to support these other food sources, the home, the wild, and the temporal markets, especially in relation to these more permanent shops that have a lot more accessibility of these processed foods. So in conclusion, overall, I found that women's food environments can be incredibly complex, which really does highlight the importance of these systems-based holistic approaches. I also found that women's agency is an incredibly strong mediator of her dietary quality, which historically may have been overlooked, but now is a strong opportunity moving forward to ensure that these elements are considered and addressed in future policies, programs, and interventions to be able to maximize the effectiveness of the resources used, especially in some of the most low resource contexts. In the case study from Northern Uganda, I found that local food-based strategies could improve micronutrient adequacy within the cost of women's current diets. So in other words, in a way that could be affordable. But however, there was some micronutrient gaps that would be incredibly difficult to close, which would require other layered interventions and approaches, especially for iron and vitamin A. And finally, we were able to identify that policies must tackle the underlying structural and social cultural drivers of women's food procurement and dietary quality, in addition to all of those other standard food environment interventions. So in other words, really multi-sectoral, multi-layered systems-based approaches are going to be required for us to effectively be able to address malnutrition in women long-term. So thank you very much for listening. I'm sorry that I can't be there with you in person, but very happy to take any thoughts, feedback, comments, or questions. Please feel free to reach out to me on this email address at any time. Thank you.